name is Dr. Tracy Karras, and welcome to the SOH, otherwise known as the state of healthcare. The state of healthcare in the United States, let's be honest, is actually one of illness. We spend far more money than any other nation to receive less care and less quality of care. Walter Cronkite calls it neither healthy, caring, or a system. As a healthcare professional who's had 20 plus years in this system, my focus is on prevention and education and trying to get patients back to actually enjoying happy and functional lives. So it's frustrating to me when I have to watch my patients and my friends and my family fight against a system just to get what little care they do, and oftentimes get a medication thrown at them instead of actually looking for what the problem is, or trying to find a healthier alternative that's not going to damage them in the long term. That's why we're here, so I invite you to join me on this journey. We're going to be starting to raise awareness. Awareness is the first step in any good 12-step program, right, to making change. We have a broken system where only a few people profit, and I'm not picking on all of those hard healthcare workers in the trenches, because those are the people unfortunately getting burnt out and leaving the system. So we need to figure out what's going on. So in this podcast, we're going to be interviewing some healthcare professionals, people in the industry, people surrounding the industry, and try to figure out what's going on here, what's broken for them, what would make their lives easier, and how we're going to do this. So welcome to the SOH, and let's figure out what's going on. Hi, and welcome back to another episode of the State of Healthcare. I'm here with Dr. Steve, and I'm actually going to let you introduce yourself and kind of what you do.
Yes, so I'm the Director of Lifestyle Medicine at the Optimal Heart Center and Body Lab, and I work one-on-one with patients, giving them a total body evaluation, and then come up with a prevention plan or action plan that best meets their needs for health, quality of life, longevity, you name it. We try to use lifestyle medicine to help them move forward with their decreased risk of heart attack, stroke, diabetes, Alzheimer's, some cancers. So the whole area of taking lifestyle medicine and boxing that up specifically for each person based on them, and then helping them move forward.
Can you define lifestyle medicine so that they know what they're doing?
Yeah, so lifestyle medicine is using things within maybe your everyday life, the actions that you can take that can perform like medicine. For example, when you talk about medications that people take, obviously you take them to get better, reduce risk, feel better, and so on. But when you look at, say, physical activity, you look at nutrition, you look at sleep, you look at stress, you look at relationships, all of those can actually have a more significant impact on your health and well-being than medications. And so it really is a lifestyle medication that works, medicine that works like something that might be prescribed to you from a physician.
So if a patient were to come in, kind of walk me through the process, like how does it work for them?
Yeah. So if a patient comes in to the Optimal Heart Center and becomes a member of our practice, we're a concierge medicine practice. Everything we do here is on an annual membership because it takes time for people to change. And they come in, they spend basically half day or more with us on the first day, with the cardiologist, with myself, with our lab techs and so on. And we collect a lot of data because it's really not fair to guide people unless you know something about them, not only talking to them, finding out the kind of person they are, their behaviors, current behaviors, but also the data of what's going on inside of them. And so once they go through that, the first day, we spend a lot of time sending out for information from their labs if they've taken labs. We analyze all the data. We powwow together to figure out, okay, where are some gaps and where can we help this patient the most? And we put together a prevention plan, and then we follow up. And we continue this process throughout the year, tweaking everything. And you can think of it as when you get a prescription from the doctor. Doctor writes you out a medical prescription. You take it, and they kind of test your blood maybe a little while, see if you're changing. And if you're not, then they may add another medication. They may up your dosage. We pretty much do the same thing here with supplements, with physical activity, with nutrition. We see what's having the most impact on a patient without the negatives, and things that fit into their life. So I guess that's probably when it comes to lifestyle medicine, Yes, it's change usually has to be done with people, but the key is fitting it into your life in a way that's manageable and makes sense.
Right. Because then people are more willing to participate in this program and see the positive changes. So
exactly.
Why did you guys decide to do concierge medicine?
Yeah, so it actually was the was the thought of Dr. Feyrer-Melk, my wife, who's a cardiologist, who's a traditional cardiologist, and she would do heart caths and see patients for 5 to 10 minutes, and then write them a prescription. And it got to the point where she was doing more research and knowing that there's so many things you can do to prevent disease. And so she started to introduce that to patients, but insurance wouldn't cover it.
Of course.
The lifestyle parts, maybe some new testing. And so she started to get pretty frustrated. And then one day she was doing a heart cath on someone, and they were being wheeled out of the cath lab. And Dr. Feyrer-Melk said, "Now, Mrs. Johnson, make sure next time you have these feelings, this heart attack, make sure you take your nitro, make sure you do this, make sure you call 911. And the nice patient said, "Dr. Feyrer-Melk, why aren't you preventing my heart attack instead of just telling me what to do with my next one?"
Gosh.
And she basically, that was the breaking point. And so we made the flip and decided to do all prevention, all proactive prevention things.
Right. Nice.
Yeah.
I feel like I wish there were more programs out. Like, this is why I've been so inspired by your program and what you guys do. What would you recommend? Like, what, I guess a lot of advice, and I know each patient's individual, but if you had to give advice, maybe along the prevention line for the average patient, what are some things that you would, I guess, say or on?
Yeah. So the key is when it comes to the lifestyle medicine side of it, if I can specifically talk about that, is finding basically movement and finding some movement. And that's the beginning of it. It's not the only thing, but the beginning is movement. And we know that moving every day has a positive impact on so many different things. It's actually almost silly to say that, but it is. When you look at physical activity and exercise, you can see a 14% decrease in risk of all-cause mortality by being on a regular exercise program. And there aren't any drugs that come to that level.
Right.
So finding a movement that you like to do, and then slowly increasing that change. So my training is not only in exercise science and wellness, it's in behavior science.
Okay.
And there definitely is a behavior component of this that is probably the most important part. It's finding something that matches, ramping it up slowly,
right,
and trying to get over that negative momentum and turning it into positive, and giving yourself time to do it.
Right.
It's not going to be the short-term changes because they're not going to last, for one thing. So I guess that would be my biggest advice: would be find something you love to do that's moves your body, and try to get in a routine with it.
Now, do you have a lot of people coming in just wanting to focus on weight loss or things like that? Or because I know we talked a little bit about the importance of maybe more like focusing on building muscle, or the positives of things like movement and stuff like that. So how do you take that when you're working with people, when you're talking on, like, they're coming in and they're just focused on the pounds and the whatever?
That's a great point to make. Great question. Unfortunately, with most Americans, the largest negative, no pun intended, is having extra body fat. And so that can have so many negative consequences on so many different things. But it's one of the hardest things to address if you don't get professional help with it, with guidance, or you've had failures in the past. So it's very hard to get into that. So the advice or the thoughts about that would be, first of all, not focusing on the weight loss,
right,
and focusing more on the movement part and finding something you enjoy to do, because there's a whole process that occurs with this. And you mentioned it in your question, was muscle mass. One of the biggest reasons I believe that New Year's resolutions fail is because people do a great job going. I'm going to go to the gym. I'm going to do it 3 times a week. I'm going to lose weight. I'm going to do all these things, and they're in the gym for 3-4 weeks, and they get on the scale and they're not losing any weight. They may actually gain weight. They're thinking, why did I sweat? Why did I take this time? Well, most likely they gain muscle mass, which is a great thing, because what that will do is start burning more fat because of your metabolism and so on. So from our perspective, Yes, there are a lot of people that come in that need to have their body fat addressed. Very rarely does somebody have a healthy percent body fat. That's just common. So it's a matter of saying, okay, let's start with this. Let's maybe lose a few pounds of body fat through this movement, and then your joints will start feeling better. Your body will start feeling better. But one thing you won't do is you won't find Dr. Steve asking people to weigh themselves every day, or actually, I'll probably ask them to throw their scale away.
Right.
And the last thing I would say is that when I went through my training 30 years ago, it was the thought back then was if you work hard, you're going to lose body fat. If you work hard, and anybody can do it. Well, that's not the truth. And I say this as a quick little story it's probably 8 years ago where I looked down and I gained 35 pounds of body fat. I'm an expert in lifestyle medicine, I'm an expert in the field, and I gained a lot of body fat.
Okay.
And so I had to struggle and see what it was like and go through that process, which was the best lesson I've ever learned. And I use that when I help other people, that it doesn't matter how much you know. It has to do with the behaviors and then making it a priority with your life and not worrying about the scale weight.
Right.
Yeah.
No,
yeah.
And to be honest, that's a little bit of kind of what I encounter for therapy. So that's why I love, where so many people are like, but I want to do this. And I'm like, your exercises need to focus on building muscle and functional things, and the rest of it will come.
Yes,
and if you're, and that, I love that you guys focus on the behavior changes and the lifestyle portion of it.
Yeah.
How well, and I guess it's that tricky question, but how did COVID impact your world?
Oh, wow. Yeah, COVID was actually we never closed down. We were open every day. It actually positively impacted us.
Interesting. Okay.
Yeah, very positively, actually.
Okay.
It was actually one of the most significant things in the last 11 years of our business that was positive. And what we found is people taking more personal responsibility for their own health care. And knowing that they could do something about reducing their risk. And what was eye-opening for us when we started to see the information of what was decreasing the risks were all the things we were doing in here.
Interesting.
Everything you do for heart health, for decreasing cancers, for improving longevity, all of those things that we look at and we help people do was decreasing their risk to be basically killed by COVID.
Oh my goodness.
And so the interest of our practice went through the roof. I mean, it's higher now than it's ever been. And one of the reasons, I'll go back to people, I'll say, you know what, the vaccine's not going to help me. Certain medications aren't going to help me to the point where I'm going to be helped with anything, not just COVID now. They're like, oh, I may have to do something about this personally. And so that has had a significant impact. So we love it because our philosophy is we have to meet the patient halfway.
Right.
They don't have to hold the whole load. We can't hold the whole load because we can give the advice, kind of like you give the advice, the guidance. And when you're not with them, they have to kind of follow that plan and do it. So when a patient comes in and says, Dr. Steve, thank you so much. I'm feeling so much better. My joints are better. I'm stronger. I'm doing stuff with my family more. They say, I said, don't thank me. You're the one out there on the taking your walks, maybe doing some band exercises, working on your relationships, getting better sleep, all those things. It's not me.
Right.
I'm just the guide, and I'm the one who is your consultant behind the scenes that's helping you go through that.
No, I love that. I actually just did a post recently talking that my most successful patients are the ones that I'm like, I will be there for you, but you've got to meet me halfway.
Yes.
The ones that do their homework, check in, talk to the therapist about stuff. Those are the ones I see the most success with because you've now made a change and you're owning it. And I'm just here to help you go along the pathway.
And it's the same, even when you talk about prescriptions with some people, when you give them a prescription, they still have to take that prescription every day. And it is surprising that not everybody does either. Or supplements. We're very, supplements are really important to this. Evidence-based supplements that basically act like medicine. So we measure those with labs, just like we would with a medication. And if people get onto these supplements, which are much more better for you, and their nutrition plan, whatever it is. And if they don't, though, if they're skipping, if they're only taking their medication once or twice a week, that's still a behavior that has to be worked on for them.
Right.
And we have to show them that, look, you your health and well-being has not improved. Let's find out why.
Right.
And it may be because they don't like swallowing all the pills at once, and then they forget. It may be that it gives them a stomach issue when they take them. So then we work with them to find out ways to work around those negatives, just like exercise and nutrition. We help them work on ways to look at a menu or what things to do with exercise that fit into their life, because we all have time constraints and our own issues with why we may not do things, or we may not choose what's probably best for us.
And I like that you're also trying to find all those different, because I feel like that's it. People go out to eat and then they're like, that's a stressor.
Very
and then
much.
you're kind of addressing all those things. So it is a nice guide with that.
Yes.
I would take one of the negative questions, but what the state of healthcare, that's what we're talking about.
Okay.
Our healthcare system now. Again, some people have talked about how Western medicine is doing what it's supposed to do, right? It's you come in, you're like, oh, it's here's your Band-Aid, and then let's go.
Yeah.
What are you feeling that needs to be improved, or what are your thoughts on our Western medicine system here now?
Yeah, so I think that thought, I mean, we're the best in the world at diagnosing and treating. We're the best in the world. And we've got great doctors. So if something acute comes up that I need fixed, they'll fix it. The problem is on our journey to that illness or that sickness, there's so many things that could be done to prevent that. Not from a sense of that that makes me live longer, sicker. It helps me so that I never get to that point where I'm debilitated or I'm a burden on my family or it's just a negative on my finances. So with healthcare today, yes, I think we do that very well. However, the things that are preventive are not usually paid for.
Yes.
So people have to pay out of their pocket more. And that's where education, when we talk about educating patients, it's a matter of what value do you put on your health and well-being? What is that value? And is it worth pulling out my wallet and giving somebody like you, like me, cash to pay for it? Because we can't be paid by the insurance companies because the things we do are not money makers for the hospitals or even
the pharmacy
or the pharmacies and so on. So we have to, gain that trust and that customership from that. And so is it a value to reach in? And then thinking about the other things you spend your money on, what are the other things? And are those things something I could put aside if I can't afford this extra care?
Right.
So in a nutshell, I don't know when this will change, but from a patient perspective, that's where it's going to come from.
Right.
And that's a great point, because that's where our interest is coming from. Our interest in prevention and being proactive has come from what people have seen during COVID.
Okay.
Including not being able to see their doctors, including have to do a psych visit online.
Right.
Okay. So they're like, okay, wait a minute. What?
Why am I doing this with my insurance?
Yes, exactly. What am I getting for my insurance? And maybe if I take a little more personal care, I can prevent these things, which we're not just talking about freedom of disease.
Right.
We're talking about living life to the fullest.
Right.
Too many Americans don't, and it's really sad to see. And, we start to change what's important to us by what we can do.
Right.
So we end up maybe watching more TV. I mean, there was so much weight gain during COVID, and it's not because people wanted to gain weight. It's because their gyms were closed. They were afraid to go outside. What made them feel good might have been food. So those are behavior things that happen to everybody in some way. So turning that switch and saying, if I become proactive, it's not just because I don't want to have a heart attack. It's because I, of course, don't want to have a heart attack, but I want to spend time with my kids. I want to be able to exercise. I want to be able to hike. I want to be able to play golf. All those things that maybe you said I can't do because I'm getting old or I'm starting to have some disease and my doctor's just giving me a pill. They're people about being more proactive. Will it ever get that way in the United States? I don't know. There's always going to be a certain percentage that might move that way.
Right.
And will it ever be paid for? I don't know that.
Yeah.
I don't know if it will be.
That's the tricky part. There's this small optimistic part of me that's hoping that the more patients that demand this, because I did read a thing from Medicare that said basically anything prevention of disease is not considered medically necessary.
Yeah, exactly.
And I was like, what?
Exactly.
In my mind, you would be paying less because these people are healthier, right? So why not pay for the prevention? But I realized it's also not the moneymaker because you're not getting all these drugs and you're not doing all these things. So there's something in that system. So you hope ideally, but patients eventually the demand is like, no, I don't want to have this insurance because I want to do this. So I'm actually excited that your business well, you guys have a wait list and stuff now, right?
Yeah.
Okay.
Yeah, we have a wait list and we're not in a position, we're not the kind of practice that can bring on other physicians or bring on, we have one physician, one exercise lifestyle medicine guy, and then the rest of our staff, because it's a philosophy. And so going back to why there aren't more like this, and it will gain momentum. I know it will, but if you think of the doctors now, the MDs now that were trained, most of them are not trained with prevention in mind. It's a whole different mindset. It's what you just said about medically necessary. Most physicians are trained for what's medically necessary.
Or what they can get covered or what like give them like you get paid for this.
And you have to. It's
you have to survive to keep your lights on, right?
It is still a business. I mean, I have a daughter going through medical school right now. She just passed her first level of boards. I've watched what she's gone through the last 6 years or more. She's got a long way to go yet. I mean, she's going to be in debt up to way more than we were ever in debt. I mean, it's unbelievable how much debt she's going to be in. And so she's doing it not to make the money. She's doing it to help other people, knowing that she's going to be compensated. Of course, that'll pay off her bills. I mean, you don't go into medicine to become rich. You go into medicine because you want to be a healer. You want to help people. You want to get them better. So, but there are so she's actually getting more preventive training right now.
Okay.
So I'm noticing that as opposed to you talk to an older doctor, and I mean older, maybe 50 years and over, that they didn't really touch on prevention. So that's outside their wheelhouse.
Even like they didn't really get nutrition either.
No, not at all. No.
So it's funny because people go to their doctor, like I'm gonna ask my doctor what to do about diet and nutrition, and they had like a day, whatever.
If they even had that.
Right. But
if they even had that. And quite honestly, that also brings up that you get your biggest bang for your buck with health from nutrition. Yeah. Absolutely, hands down. You cannot exercise your way out of bad nutrition. And so if there's one place people want to start, one way it might be portion size, just cutting it down 10 or 15%. It might be starting to lower the red meat intake and go into more fish, and definitely hit the veggies, because you can eat as many veggies really as you want, complex carbs, and feel full. And you'll probably lose weight. Your lab numbers will start improving just from nutrition.
And just even making those little subtle changes.
Yes.
Right?
So. Yeah. And so when your doctor says, Mr. Johnson, we need you to exercise and lose weight. And they're like, okay, how? Well, I've got another patient right now.
Yeah. And then
so good luck with that.
Right. Or they hand him a paper.
And then, here, go ahead and do this. And so we're on our own basically with that. So, and because it's not because they don't want they don't want to help you. It's not because they don't, well, they may not know because they're not trained in that, but it's not because they don't want to help you or don't want you to lose weight. It's because they don't have the time to do it, and they weren't trained to do it because they were trained to do other things to get to where they are.
Right. And again, that's probably, what's nice is that when you come here to see you guys, you get that whole
thing.
Time,
yeah.
Right. And your labs are in-house, right?
Yep. Labs are in-house. We have we have a PhD level holistic nutritionist that basically the patient has unlimited time with them. She'll actually go shopping with them.
Oh my gosh.
And not to say, oh, you shouldn't eat this, you shouldn't eat that. It's basically, Mrs. Johnson, this is what you usually or Mr. Johnson, I do the cooking in my house. This is what you usually use. Let's see this one over here might be just a little bit better choice. It tastes about the same, but it might be a better choice for you.
Right.
So our Dr. Donna will go through with them, and she'll find little things that tweak, because a lot of times it's little things. It doesn't have to be these huge things. It may end up being that way in a year or two,
right?
But it may be just a few little tweaks in a nutrition plan that make the world of difference with people.
Well, and then also I feel like if you're just doing little tweaks, it's easier to make those changes, right? So even for me with patients, I'm not like, you have to do these 50 exercises. Like, we start with like 2 or 3, right? Focus on this, and that's your one thing, right? And then it's more likely to become a habit for everybody.
So I have a question for you. Okay. So what if a patient comes to you and says, I want to do it all. I want to get all these changes by, in 6 weeks because I've got this big event. Just give me a plan. Give me all the things and I'm going to do it. How do I approach that?
Okay. Usually we sit down and we kind of make a realistic goal, right? We say, okay, this is where you want to be.
Yeah.
And then I have to say, like, I'm going to need you to meet me partway. Like, if you're going to expect me to develop you a program, you got to buy in, right? Yeah. And so I'm like, okay. And then we maybe redefine what some of that is, because I also don't want them to leave and then be like, well, I didn't make changes in 2 weeks. Where's my stuff, right? And I have to say, I need you to trust me. So I need that trust that what the process is. Don't be out going doing your own thing, as terrible as it is, because that's also the hardest part for me with patients. Is then they're going to go on Instagram, or they're going to go on YouTube, or they're going to see something on the internet, and they'll be like, I tried these exercises instead. And I'm like,
that's not what you had.
Yeah.
What I liked what you said, your first part of the answer was you'd sit down with them and have a conversation and make sure that you're on the same page and they understand it realistically from both sides.
Because I also need to understand the goal, right? And there's things where I'm like, and sometimes I feel like as a therapist, I also have to have those awkward conversations with people of like, you have this, whatever.
Yeah.
This will be with you the rest of your life. We will now have to make changes for the rest of your life. I'm sorry your doctor didn't tell you that.
Yeah.
But welcome to the rest of your life.
Exactly.
But it could be so amazing.
Yes.
Sometimes I have things where I have people come in and they're like, but I've been diagnosed with this, and it never occurred to me I could live a life without back pain. It never occurred to me I could do this. It never occurred to me I could meet these goals. And sometimes I think having small successes initially helps build upon their willing to like go with the other things.
And being honest, like you're saying, being honest with patients is so important. Not just patting them on the back and say, oh yeah, we'll get there in 6 weeks, and knowing that, you know what,
you're like,
unless they can be a full-time they have a full-time chef and which nobody does, full-time exercise coach, a full-time therapist, a full-time, it's just some of those things are physically impossible,
right?
But at least they're making their way towards that.
And then I also go over that therapy is a little bit of like this. So there's going to be these.
Excellent point.
And so like you're going to have gains, right? And then you're going to have a moment of like, oh no. And then we're going to have gains. And then we're going to go, oh no. And then that's how we learn together. Like, what does your body handle? Everybody's body has a different condition or ability. So we go through the process a little bit.
You mean there's never any setbacks or anything?
Yeah, well, I know. I'm like, there are.
Yes, it's
prepared for that.
Prepare for those setbacks. We all have them,
and that's normal, and it's okay. And just open communication with me. Like I like to keep it very open.
Oh, I love that.
Where they can send me a message, and I'll be like, okay, yes, here's what we're going to do about it. And so that's how I usually approach it. And so every patient for me that's why I do customize my own stuff as well, because I like to sit down and make my kind of like you guys. You sit down, you get to know that person. You want to know what their goals are. And then even before each session, I'm like, okay, we're going to review, but where are you at this week? What are we doing? So I usually touch base with them before their appointments so we can know where we're heading in together.
Yes. And so you probably want to hear about setbacks as soon as they have them, as opposed to 2 weeks down the line.
Right. And then it's easier to
yes. Oh, please. If you're listening to this, make sure as soon as you have a setback, try to connect so that you don't fall off that wagon too far.
Right. And I'm sure that happens probably with yours, but because for me, I don't want my patients to get upset and then they're like, I'm not going to do my exercises. That's not because now we're like, all that work that we just did. Whereas if I can catch it and we can figure it out and work together, we can go back over it and use it as an education tool.
Absolutely. We call it the detraining effect. We don't want a big detraining effect. We don't want to lose all that training. You can always lose a little.
Yeah. And, you can come back. But so I am always encouraging them. And sometimes, I'm always like messaging but I would rather that communication than I would to be surprised, right? When they come in and like, by the way, and I'm like, and then we have to have another long conversation and I feel really bad. So but
absolutely.
I don't know with your patients. So if someone wanted to check out coming, I know you have a wait list, but
Yeah.
like, what are the call in, check
Yeah.
out the website,
Yeah,
or what?
absolutely. The best way is to look at the website.
Okay.
We think it's very informative. There's actually some things on there that are educational.
Okay.
So, but the website's probably the absolute best place to get information about the things that we offer.
Okay.
Yeah.
So they would go online to like Optimal Heart Lab.
OptimalHeartCenter.com.
Okay. Perfect.
Yeah, that's pretty easy. Optimal Heart Center.
Okay.
Yep.
Perfect.
Yeah.
And then I guess as we're going through, is there anything else you would want people to know about your practice or just things in general?
Yeah.
Or I feel like you've given such good like tidbits along the way of everything. So
yeah. No, I guess that I guess my statement would be that we have to think of our bodies as our bodies. And we can't really, as hard as it is to say, we can't expect someone else to take care of it. I mean, a lot of people really do a great job washing their cars, taking it in for it, getting clean, making sure the tires are filled. There's some people that are fanatics about their vehicles. It may be your kitchen, it may be, your cycling, whatever, something that you have, but you should try that same on yourself. And the prevention part of it on your body. And don't sell yourself short that, oh, my parents, they died at such an age, or they were laid up and they never were active and they can't travel in their later age. That doesn't have to be you, no matter what your genetics are. And that's another thing, if I can just jump into the genetics part. We do genetics tests on people to find out all health things. And some people say, oh, I'm afraid of that. Don't ever be afraid of genetics, because the genetics are not the important part. It's what you do with your genetics. Okay. So it's the epigenetics. It's how you go ahead and express the positive. That's what we talk about. We want to express the positive and push down the negative genetics. So, for example, I have a bad gene when it comes to storing toxins in my body. I never knew that. And so I would never go into the sauna, but now I do, because I know sweating helps.
Interesting. Okay.
Do I have to go? It's good for if somebody doesn't have this gene, do they have to go in the sauna? Not necessarily. They can still go in. Right. But I actually do it for a medical reason now. So those are the kind of things. So now we're going to push down that negative of my toxin holding. Right. And we're going to see what I have good expression in a power gene. So muscle mass gene. Right. So I try to work and express those. And everybody has different genes that we try to express the positive, push down the negative. So if there's a genetic test you can get, don't ever be afraid of doing it. Information is power.
Do you also, and again, veering on a little bit, I get a lot of people who are like, well, they get told their doctor, it's just you're getting older. All the time, right? It's age related, and they're always kind of dismissed based off of that it's age. And
absolutely not. We don't even use age in here. What we do is we'll look at your epigenetic age, we'll look at your cardiovascular age, we'll look at your telomere age. That's really your age. But does it define you? No. And what can you do about it? You can actually reverse those and improve your age. We have patients that are 80s and 90s that are still active. And when you talk to them about it, do they say, oh yeah, I just got good genes, or I see they got great genes? No. They have made these small steps during their life, and maybe some of them just started a few years ago, maybe 5 or 10 years ago, and they're in their 90s now, and they're still golfing, they're still traveling, they're still doing things with their families. And I mean, you see people that are in their 70s and 80s that are doing things, you're like, gosh, how are they doing that? Well, most of the time, 99% of the time, is because they're actually moving and being proactive and being preventive. So age is not a definer. When somebody says, oh yeah, I guess I'm just getting old, that's why I can't get up and down from the chair very well. No, it's not.
Right.
Because there's things you can do right now if you're 80 years old that can help you and reverse some of those negatives.
I think for me, so my dad's 90 and he still goes out and does, he's so active. He's always been like kind of an inspiration to me,
Of course.
Every time I call, my mom's like, I don't know, he's out somewhere and he's doing whatever. So he's just always been a mover. And but it's interesting because he had to have a surgery and they were like, well, how long do you intend to live? And I was like, that's a rude question. That is a rude question. Because I think if I went in, they might be like, okay, you discussed the surgery, but whereas for my dad, who's 90, they're like, well, do you intend to live
Unbelievable.
And he's like, well, I'm going to be 108 at least, so let's do this.
Well, because if somebody comes in and they're in their, say, 70s and 80s, the doctor will look at them and say, well, why should we put a knee replacement on this person? Because, they're. But then I always tell our patients, you got to tell them you're an active person, especially if you are, of course. But if you're an active person, you don't want to just go and have somebody say you can't do a certain procedure because they may treat you like a typical 70 or 80-year-old. Unfortunately, the American 70 or 80-year-old is more sedentary, but you don't have to be that way. And so they look at you and say, well, you're going to live long because your dad did. No, you probably won't, because you could have behaviors right now that it doesn't matter what your parents are.
Right. Yeah. I could be setting yourself up probably.
Exactly. So that's why you stay active as soon as you can, whenever you can. And it doesn't matter when you start. You can be 20, you can be 80. Yeah.
I feel like that should be the take-home message.
Yeah.
It's like movement and movement, and it doesn't matter. It's never too late to make changes.
Never. Absolutely never. And consistency with those changes once you build them up.
Yes. So
work them in your life. Find something you love.
Right.
Find something you love and move.
Right. So it doesn't mean just like one day, but like build into it slowly. And
have a professional who can help you gauge those things, because a professional can measure those things, and then give you feedback based on what you're doing, so that you're not wasting your time.
Yes.
You're not doing things that you really maybe are doing too much. What if you heard you were doing too much?
And then you're seeing a physical therapist because now you're like, and that is actually ironic. I do get a lot of people who are like, but I just started an exercise program.
Yeah.
So they want to do the positive things, right? They go, but then they get hurt because they didn't have the initial guidance. So that's why I always tell people, I would rather you start with me. And then maybe we just check in.
Yes.
Then I would have you just go do a thing. And then I'm treating you a bunch later because you hurt yourself. So either way, you're going to hang out with me.
Exactly.
It's better to do it early and less than it is because we now have an injury.
Love it. Absolutely love it.
So I think that is all my questions. But if there's anything else, again, check out their website. And again, I appreciate all of your advice today. And we will go ahead and sign off. So thank you.
Okay.
Thank you again for tuning in to the SOH, or State of Healthcare. This is Tracy Karras from Better Fit Therapy, asking you to tune in each week as a new podcaster. If you can like, subscribe, share with your friends, find us on social media, but also feel free to comment. Let us know some areas you'd like to explore. What are some concerns you have with healthcare? Let us find some areas that would help relate to you, what's going on with everybody else, and help me raise some awareness so that we can work on some change. Thank you again, and have a good night.